Good afternoon, my name is Olusumbo and I will be talking about how airways flows when we breathe, when we inhale air and when we exhale air, and the effect of asthma in the lungs and bronchioles. So the airways of a person without asthma is not constrict, but people with asthma, they have narrower airways and their airways are irritated, hyperactive. So in this scenario, we're going to discuss the process of inhalation while pulling down on the bottom balloon in the video we watched. So the pull down of the bottom balloon puts air in the lungs, which helps to inhale air, while the push up on the bottom of the balloon removes air from the lungs, while this helps the exhalation process. Some people have a larger lung than the others because of age. As we grow older, our lungs become smaller, and this can also be due to diseases. When the muscles of the diaphragm get weaker and the lung tissue that keeps air open lose its elasticity, which means we have little air, and that makes the lungs smaller. Some of the effects of asthma on the lungs. Asthma makes it difficult for people to breathe because there's a tightness in the chest when you have asthma, and this makes the airways and the lungs to be narrow, which makes it difficult for oxygen to flow from the lungs to other parts of the body. The priority medical action, the priority nursing management for a patient with asthma is based on the age of the person, the severity of the asthma, and your response to a given treatment. So we use both pharmacologic and non-pharmacologic treatment. The pharmacologic treatment is the use of corticosteroids to reduce the body inflammation response. Some of the medications that can be used are omalizumab, mepolizumab, resolizumab, and benralizumab to target the specific parts of the body that is susceptible to allergens. We can also use the long-acting beta-2 agonists like the inhalers to reduce the symptoms of asthma. So the teaching for the patient, patients who have asthma needs to be educated about asthma triggers like allergens, smoke, mold. If you have asthma, you should not go to a place where there is smoke or mold or chemical irritants. So the patient should also be educated to avoid extreme cold or hot environment while traveling. We should educate the patients about what to watch out for when they have the symptoms of asthma and the importance of calling the doctor if there's if the person cannot breathe, or the person can be educated to go to emergency room. Some of the resources that are available for asthma patients are support groups. Support groups help people with similar disease to support each other, and patients should be educated to stop smoking. There's also a long helpline that people can call for support, and there are some clinics that offer inhalers and medications to people who cannot afford the bronchodilators and other medication. Thank you. The reference for this video is from Teach Engineering, Hands-on Activity Creating Model Working Lungs, Just Breathe, and the website will be included in the video. Thank you. Have a wonderful day.